I feel like if they didn't have the override, you're making a ridiculously difficult situation almost nearly impossible.
Step therapy protocol, also known as Fail First, has long caused the lives of those suffering with chronic illnesses to be even more difficult.
Basically, your health plans will tell a doctor what treatment they should try first,
causing some patients, like Brian Bierbaum, who lives with MS, to try and fail multiple drugs before their insurance would allow them to take the medication their doctor first suggested. Oftentimes, this leads patients to having worsening symptoms for their conditions.
During that time, I went from being numb from the waist down to essentially here, and then my entire body is completely numb.
And to make matters worse, some patients had symptoms from the medication they were forced to try, which were worse than their actual illnesses.
With one medication, I mean, I was sick. I had the worst flu-like symptoms you can imagine every 3 days for 3 months.
Now, patients with chronic illness have some hope.
Then I started to hear stories of other families, and when I was hearing those stories, I thought something needs to be done about this.
Representative Kelly Fenton and Senator Paul Uckey were the chief authors in the House and the Senate on step therapy protocol override legislation. Medical Alley Association was part of a coalition of patient and provider organizations, including the Epilepsy Foundation and the Multiple Sclerosis Society, who worked with lawmakers to successfully pass legislation that will put common sense guardrails around insurer step therapy protocols.
Really, this legislation, it's about the patient and about the person, but it brings the patient and the doctor back together.
Groups like the Epilepsy Foundation and MS Society agree, saying this move gives patients with chronic illnesses and their loved ones hope for a brighter future.
It's just a sigh of relief, I feel like, that they can get these drugs that they need rather than wasting time going through the wrong drugs or drugs that aren't appropriate for them.
To learn more about the legislation and Medical Alley Association's advocacy, visit us at medicalalley.org and subscribe to our advocacy newsletter for the latest updates.